Good evening, respected teachers. My name is Dr. Muthu Alagappan. My topic for paper presentation is mucormycosis. We will not be the same people we were. Our experience after surgical management of 109 cases. Moving to introduction, outbreaks and clusters of mucormycosis are rare, but when they do occur, they often occur seriously. The term phycomycosis was suggested by M. Noss and first described in humans by Alcock and later coined as mucormycosis in 1957 by Baker. It is an anglo-invasive fungal infection in which molds called mucormycosis cause disease that is characterized by tissue infection and necrosis. Moving to epidemiology, various authors have described the epidemiology of mucormycosis in India over a period of years. According to them, the annual incidence of mucormycosis in India is 19.78 cases per year. But from the onset of COVID-19, there is an enormous surge in the cases of mucormycosis in India. India has witnessed 60,138 cases till September 25, 2021. That is, for every 1,000 COVID cases, there is the occurrence of 2 to 3 mucor cases. These are the predominant status where mucormycosis cases have been reported in India. Microbiology of mucormycosis. The order Zygomycetes and the family Mucorales, Entomophthalus, both are responsible for this particular fungal infection. Among mucorales, Rhizophilus is the most predominant organism which causes mucormycosis. Both in the KOH mode as well as in the histopathology, the fungi can be seen as with the branching 45-degree branching or 90-degree at right angles. Pathogenesis. Increased supplementation of steroids as well as pre-existing diabetes mellitus both are considered to play an important role in the pathogenesis of mucormycosis. That is, because of immunocompromised status, there will be a defective phagocytosis. If there is no proper phagocytosis, spores which are released by fungi will escape and will develop into hyphae and it will cause destruction of the tissues. Iron uptake. COVID-19 targets hemoglobin, in which there is release of heme and which there is excessive iron in the human body. Because of the excessive iron, there is excessive production of ferritin, and this excessive production of ferritin in turn causes hepatic cell death. Hepatic cell death in turn causes production of more iron. This favors the growth of microorganisms in the human body. Insulin is to iron what insulin is to glucose. Insulin will take the glucose from periphery cells. Epsilon will do the same to the iron. And also the viral mimicry, the COVID viral spike protein mimicry to the epsilon spike protein also plays an important role in pathogenesis of mucormycosis. Interplay with the endothelium. The mucorales, when attached to the endothelium of the human body blood vessels, it will release 4 hemologs, which is unique to mucorales. This will interact with the GRP78 receptor, which is in the endothelium, and it will cause fungi to endocytose. Voriconazole exposure. Voriconazole is an antifungal drug used in the treatment of invasive aspergillosis. But epidemiological studies reveals that this voriconazole exposure causes hypervariant growth of mucor and rhizopus species. At the same time, when this voriconazole drug was withdrawn, hypervariant growth of mucor and rhizopus does not last. Presenting you with the cases which reported to institution. Case 1, mucormycosis of zygoma. This patient is a 33-year-old male patient who got COVID positive in the month of May, and he was in home quarantine with oral steroids, 8 mg of prednisolone for 8 days. There was no intraoral positive findings. Extraorally, swelling was there in the left midface region, and in the CD, osteomyelitis kind of restriction was seen in the left zygoma. This patient was posted under GA, and the lesion was excised. This is the 3rd month postoperative clinical picture, radiographic picture. This is a case of mucormycosis of inorbital region, where this lady presented with loss of vision in the left eye and first discharge intraorally as well as in relation to left eye. And this case was posted again in the GA. The propagation incision was planned, and then the necrosed maxilla was excised. And this is the post-op 3rd month follow-up picture, and this is the extraoral picture. This is a case of mandibular mucormycosis, where the patient presented with the erythema, ulcer, exposed bone, and loss of tooth in the mandible from premolar to molar. And then this case was posted in the GA, and the necrosed mandible part was excised. This is a picture of post-op 15th day clinical photo and CBCT. All 3 patients was given 300 mg of liposomal amphotericin B, that is 3 to 5 mg per kg for 10 days. All the patients were given 100 mg posaconazole thrice daily for 3 months. And then all the patients had called for follow-up after 3 months, and culture sensitivity test was done. And all the patients were turned negative for fungal organisms in culture and sensitivity test, and thus plan for further reconstruction. Statistical analysis, and hereby I conclude that most of the patients have got their mucormycosis symptoms, initial symptom, within the first within the 2 to 3 weeks of COVID onset. And these are the various description of the site of involvement of maxilla and mandible. And these are the gender, previous diabetic status, and steroids, and whether remdesivir was given or not, and perforation was present or not, and excineration was done or not. In this status, patients were exposed to steroids, and the patients were previously 83 patients were diabetic and 26 was not diabetic, but they had diabetic on the course of their COVID-19 treatment. Statistical analysis tells that there is a significant association between distribution of rhino-orbital cerebral mucormycosis stage and with parietal perforation and excineration. Since all the patients had steroid supplementation and diabetic history, there is an insignificant association. Conclusion. Thus, I conclude that we will not be the same people we were. As mucormycosis infection is unpleasant and debilitating, it leads to loss of organs and emotional trauma to patient as well as the doctors. Future perspective. Since amphotericin is very costly, around 8,000 per vial, antifungal nanoformulation is an active area of research. Currently, we have completed the clinical trials under the nanoparticle amphotericin. These are my references. Thank you.